Dr. Hildreth, let me begin with you. You're in Tennessee, which has a very low vaccination rate. It's 39.1% of people 18 years and older. And we are now learning tonight that even among the vaccinated, the dangers of the Delta variant are greater than we thought. What is this going to mean for Tennessee?
Lawrence, thank you. Good to be with you again. I think what it means for Tennessee is that we have to be more vigilant and redouble our efforts to get people vaccinated. This is not the same virus that we started with back in January of 2020. It's clearly a different virus, and I do agree that we have to have a much more concerted effort to fight this virus because it is so easily transmitted. And, as long as the breakthrough infections remain low, I think we can keep doing what we're doing. But clearly, we have to be more vigilant about this virus because it's clearly not the same virus that we've been concerned with for the last year or so.
Dr. Jha, this makes perfect sense that this is a new variant, in effect, a new attacker against us. It's like a new weapon being created during war. And of course, it changes the situation. And yet, there's so much discussion that I have seen on television among people who take this seriously, who are kind of shocked and amazed that we might have to wear masks again for good reason, just as you might have to wear gloves again this winter if your hands get cold. I mean, at some point, this babying of the talk to Americans about how to take care of themselves, it crosses a line of just utter ludicrousness.
Yeah, Lawrence, first of all, thanks for having me back as well. I mean, look, the virus keeps changing. The pandemic has changed from last year, as Dr. Hildreth said, as a different virus. If we decide that we're going to deploy the same tactics, no matter what the virus does, that would be really dumb. That would not get us where we want to go. So the CDC has looked at the data, has looked at the facts, and said this virus is behaving differently. There's more transmission happening among vaccinated people, not a lot, but some, and said, we want to make different recommendations for how people should behave. That's exactly what we want federal agencies to do. We want them to respond to evidence and data and change policy when the evidence and data changes.
And Dr. Hildreth, this happens all over the practice of medicine. You have people recovering from bone fractures who, go from crutches to cane, and then they struggle with the cane, and the doctor might say, all right, well, let's move back and try this. People have had experience with this kind of adjustment in medical recommendation throughout their own medical histories, but suddenly America is playing dumb and saying, wait a minute, you said I didn't need a mask a few weeks ago. How dare you say I need a mask now? I mean, just how do you bear this kind of just rank ignorance that's being spewed everywhere in reaction to this?
Well, Lawrence, I agree with Dr. Jha that the science is not evolving. The virus is evolving. And it gives me great comfort that the health leaders in our country are responding to how the virus is changing. So I think people should understand that science is not truth, it's the pursuit of truth. And the truth is, as we now know it, that this virus is evolving. All RNA viruses mutate and evolve. This one is no different. So I'm really encouraged that our leaders are making changes or making recommendations based on how the virus is evolving. I think that's a very important point that people need to understand.
And Dr. Jha, in cancer treatment, for example, there are setbacks. There are times when doctors think we got it. We think you're cancer free now. Year later, sometime later, cancer's back. And those patients don't say to their doctors, I am not coming back for cancer treatment. You told me my cancer was gone. I am not going to come back for cancer treatment. That is what these people are doing when they are complaining about having to put a mask back on.
Yeah, and in some ways, Lawrence, we had predicted this in the sense that we knew that while the pandemic was raging around the world, while most of the world is unvaccinated, while a third of America is unvaccinated, a third of American adults, that we're going to see things like this. We're going to see more dangerous versions. Absolutely. This is not necessarily the last variant that we're going to deal with. And people just have to sort of buckle in and get vaccinated. And if we get 90+% of Americans vaccinated, we really can't put this thing behind us. But until that happens, we should expect changes in the virus leading to changes in policy.